really, really, it is a, nationally spread out. Many, many groups have gotten involved. Unfortunately, in California, we have the Democratic California meeting this weekend, so we're missing a few people from there. Anyway, Mike is from Progressive Democrats of America. They have their wonderful guests every Sunday afternoon, and they're doing great stuff and with lots of different outreaches. I restarted the Los Angeles chapter of the PNHP, Physicians National Health Program, with Dr. Malia Grover. And we're doing a meeting right now virtually once a month with different participation. The Northern California groups are really active. ADA is another wonderful group in solidarity with the 99% since 1947 when it started. Really not meant to be partisan, but another group that's at national. And other groups have wholeheartedly contributed. The Northeast Los Angeles Alliance, California Alliance for Retired Americans, and Healthcare for All, and many, many others. And can't you see that? There we go. Okay. This day was set up really to have marches across the country, and there were many in different cities. And I'm really excited to we're going to hear from a couple people who attended. But these are the demands for a national single payer. Very logical. Eliminate private insurance. Ban for-profit delivery of care. Comprehensive coverage for everyone. Services organized to serve the people of our country, not controlled by corporation or investor profit, and removal of profit to healthcare, which really has been the downfall. Corporate care medicine, which I've watched the evolution of since the mid 1990s in practice, and it's only become more burdensome. And I've come to the conclusion markets are good for vegetables, but not for healthcare, nor for the educational system. I think that it's not to bargain who should have health care. We should have professionals decide. There we go. Everyone thinks America's healthcare is so great. Guess what? We have the worst infant mortality among all the industrialized countries. And even the wealthy white Americans have a higher infant mortality than the other sophisticated countries. And your chance as a new mother or dying during childbirth in the United States is 3 times as likely than Canada. Not common, but 3 times as likely. Now, you may not be busy having kids, but you know what? One thing that appeals to everyone is life expectancy in the United States. It has become lower than the other industrialized country, and it is dropping. Excuse me. Um,
Yeah, that's something to just look at. It's taking a couple seconds to move on to the next slide,
oh,
but,
man,
but that
I
is
just thought,
bone chilling and it just keeps getting worse.
yeah, it's getting worse. And one thing that proves that healthcare for everyone is traditional Medicare kicks in at 65. So now that I'm at that age and I can say you get healthcare without dealing with an insurance company policy, and at 65, our numbers start to match the other industrialized countries for survival. Ooh, bankruptcy in this country is the reason for 2/3 of, healthcare bills is the reason for 2/3 of the bankruptcies in this country. And most of the medically bankrupt people had insurance when they started getting sick. I started out as a physical therapist for kids, and the numbers are if you have a baby who is born with medical problems, with handicaps, there's like a 90% chance the parents will get divorced and not have insurance. That is sad. What's happened since the mid-1990s? Well, actually, this says since 1970, but really it started in the 1990s. The number of physicians increased. That little green line at the bottom, maybe 100%. But the number of administrators in our healthcare system has gone up over 4,000%. Those are the people in the office keeping you from getting approvals for healthcare. And the overhead, where your money's going, your medical dollars are going, it's going to the health insurance companies. Medicare, people say it's going to be expensive. Overhead for Medicare is only 2.3%. And that means that all the rest goes to taking care of you. We can afford universal health care. There we go. 95% of households would pay less in taxes than they are currently paying in premiums, co-pays, and prescriptions, and we would all have top dollar coverage. This is a great comparison. In the United States, Duke Medical Center down there in North Carolina, great center, has less than 1,000 beds and 1,600 billing clerks to take care of the medical bills and send you bills. In Canada, I have a friend there getting care. There's over 1,200 beds handled by 7 billing clerks. Guess where our healthcare dollar's going? And this is close to my heart. The Epic HR. There we go. Epic is one of the electronic medical records. And why is that not happening? It's loading very slowly. Nowadays, since Obamacare came in, we all have to put our notes into electronic medical records. And that means Epic is one of the biggest. There we go. In all these other countries, to write a note to document that a doctor has seen you, the doctor hits the keys on the board about 2,000 times at the most. In the United States, it's up to 7,000. Look at this. They don't even overlap. This is why 2/3 of the time doctors are writing notes on what they saw when they examined you. Most doctors favor single payer, and it's increasing. It used to be almost 60% opposed. Now it's close to 60% supporting it. And here's saying that we spend twice as much time on electronic billing records as with the patients. 1/4 with patients and half of our time on the electronic medical records. Reasons to change our healthcare system. We spend more than twice as much money on healthcare as the rest of the world. And we now spend enough to cover everyone and to add mental health, dental, and vision coverage. So when people say, how are we going to afford it? It is cheaper. That's a sore point. only because we've made it so complicated. As you can see, Uncle Sam here playing with all these different gadgets when it could be more simple. So I am gonna, and there is hope. Should I go on to this one slide? April 29th this year in Washington, D.C., Jayapal, Sanders, and Dingell introduced the Medicare for All Act with hundreds of nurses, healthcare providers, and workers from around the country in front of the Capitol building. And I've already made all these other points. So I'm going to give it over to Mike. You want to show one of the videos?
Sure. I actually was at the bill launch on Capitol Hill. It was a wonderful day. We heard harrowing stories of people who lost loved ones because we just don't have a national health plan. And it's just so painful. But what I will do now is start the video. And Barbara Harrison is asking if she could see a copy of the slides.
Sure.
So yeah, talk about the slides for a little bit, Nancy, and I will get the first video up and running.
Sure, I guess we can post it. We're going to post this presentation, and you're welcome to email me and I can send them to you. Chat.
Okay, I will now share my screen, and hopefully everybody will be able to see and hear the video. Let me know if there's a problem.
Did I stop sharing?
Don't worry about it. We'll see if that works. Hold on just a second. Share screen.
Oh, here.
I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you so much to National Single Payer
Sorry about that. See if we can get this going again.
Physicians for a National Health Program and Progressive Democrats for inviting me to share a few words with you today on this National Day of Action. I know so many of you took to the streets today and marched to demand that we remove profit from our healthcare system and truly recognize healthcare as a human right. Thank you for that showing of strength and organizing. Your advocacy on this crucial issue of healthcare access is so important, and your work to rally grassroots support and build a wide coalition for Medicare for All is truly the way to push this movement forward. Just a few weeks ago, I reintroduced my Medicare for All Act with Senator Bernie Sanders and Congresswoman Debbie Dingell, which would expand Medicare to serve all Americans. It is the only bill in Congress that outlines exactly how we would get to quality, comprehensive, affordable health care with improved Medicare for everyone. It expands and improves Medicare to cover medical, mental, reproductive, dental, hearing, and vision care, as well as long-term care. In the richest country in the world, it is criminal that 85 million Americans are uninsured or underinsured, and that 1 in 3 Americans has medical debt totaling $220 billion. And that's all while the top 5 private insurance companies have pocketed $370 billion in profits over the last decade. It is criminal. Medicare for All would finally put patients over profits, create a healthcare system where everyone is in and nobody is out, and provide healthcare to people when you need it, where you need it, from the day you're born to the day you die. It's not just good policy, it is actually popular. More than 70% of Americans support this legislation. You all know why we need the legislation. You know the arguments, you know the numbers, you know everything else that we have used to convince as many people as possible to join this movement. But I want to talk to you about how we actually organize our way towards this goal. As many of you may know, I got my start in organizing by starting an organization for immigrant civil and human rights and then growing it over time to become the largest immigrant rights group in Washington state. I've always believed that change doesn't come from the top down. It comes from the bottom up. That is the driving force behind everything that I do and frankly, everything that you've been doing today. It has to be the driving force behind our movement as we push for universal health care for everyone. We have to grow our movement to bring in more and more people and explain what we're doing. Take on the private insurance companies that are putting out all these lies. And that is ultimately how we build power and make lasting policy change and achieve justice. Now, I know that our country's current political climate is scary and that the Republican trifecta makes it hard, if not impossible, to make progress on Medicare for all. But despite that, there are still so many opportunities for us to point out the injustice of the current healthcare system, to educate the American public on the ills of what this corporate, for-profit, private insurance company controlled healthcare system is doing when it puts profits over patients. We have to continue to expand our coalition, spread our message, explain to the American people what we actually know is the solution, and show Americans that they are being lied to by these private insurance companies. We can't afford to wait or slow down on our organizing, no matter how angry or tired or frustrated we may be. I know that you know we are not powerless. That's why you've been out here today. That's why you've been channeling all of our anger and frustration into that real organizing work on the ground to rebuild our movement and show Americans that we're going to fight for them to have healthcare as a right, not a privilege for the wealthiest few. So I know that that's what I'm continuing to do, organizing both inside and outside of Congress, and I know that I can count on you as partners in this fight to make Medicare for all a reality. So congratulations again on a powerful day of action, and thank you for everything that you have done and all that you will do to win this critically important fight.
Well, how about that?
That's fabulous. Let's do one of the entertaining cartoons.
Okay. Let's talk about, Dr. Nancy, talk about what you have taken from that. And I also want to get people raising their hands and making their opinions clear about what they, I'll say real quickly just to get us started. Representative Jayapal gets it. She mentioned that she started as an organizer and she's never stopped organizing. A lot of people go to Congress to vote on different things, but she comes with a different attitude. She comes with the attitude that she's going to organize with the people like us to get change that we need inside of Congress. And that's the PDA framework. That's the framework that a lot of our allies, PNHP, Physicians for National Health Program, Healthcare Now, National Nurses United, Public Citizen, Americans for Democratic Action, so many people who've been so helpful today and many days. So if anybody wants to raise their hand and give their view of what the Congresswoman said, I'd like to do that now while I try to find the videos.
I will say that one of my motivations for doing this national town hall was that I'm really tired of hearing people saying the Democratic Party isn't doing anything, that nobody's doing anything to stop the scary things that are happening by this current national administration. And I think there are a lot of great legislators out there. They're doing all they can. And I love that Jayapal has taken the lead on this. And she has many, many supporters. I know all of my local legislators have supported her, one of whom we're going to see her video a little bit later. But it's been a long fight, and I love the people who have been at this for decades And I feel sad that it's not come farther. But I think there's progress. I see Dr. McCain's right there. Don, do you have any comment?
No, just that I have come a long way and I remain very supportive. And of course, now it's Jayapal. When I started, it was John Conyers many, many years ago. But I think we just have to continue. There are things happening in the national PNHP organization behind the scenes that I think will be publicizing these issues more widely, and I think we're going to see a lot greater support for this. Already, people are very angry with the insurance industry, and now they're beginning to understand what private equity is doing to the healthcare delivery system as it moves our healthcare dollars to the coffers of the billionaires. And I think people are tired of that. I saw a debate this week that 85% of people support what we're doing and 15% are opposed. Well, that's progress. That was a debate done in Canada. Of course, they have a little bias there, but anyway, I think as people see more passionate responses to our system, we're going to be doing a lot better.
I see Barbara Harrison is trying to speak. I am going to unmute you.
Thank you very much. As I said in the chat, if we want to create change in this country, progressives are obligated to cross ethnic, class, and cultural boundaries, forming relationships with communities that are different from them and bringing them information, listening first and foremost, and bringing them information. And storytelling is a great way to learn about people's suffering, but we need to bring everybody into the movement. It is our obligation to do that. We can't remain in our cubicles. And I did table for single payer healthcare today. Most people did know, but a few quick sentences, I gave people the background of what single payer healthcare would do for them and for everybody else. As the expression goes, everybody in, nobody out. That is how I feel about this.
That's great.
My passion. Thank you so much for letting me speak.
Absolutely. And I do want to say that there are many supporters of this day of action, and sometimes there are some disagreements, but when I said to Mike earlier today that I think if any of the ideas get single payer through, and frankly, I don't care if you call it Medicare for all, single payer, or there are a number of different labels. I think if we got one through, we'd work on it. We'd make it better.
Yeah. And I used to work a lot on the New York State Healthcare Act, but I really deep in my heart feel we need to do the national bill like Pramila Jayapal has introduced and Bernie, because the states that aren't going to cover people, they're going to have nothing. So it's fine to do state, but we have got to aim for the broader context, the whole country. That's the only way.
Absolutely.
Thank you so much. I'll let somebody else speak.
And I think one argument I get into is I like to say, even if you've never studied virology or infectious diseases or epidemiology, the fact you can understand viruses don't care who you voted for. Viruses don't care what state you live in. They are jumping to whoever will let them survive. And unless we have a medical system that covers everybody, we are not safe. Nobody's really safe. Anybody put in the chat, and I'm happy to unmute you for a comment.
And I dropped into the chat an action alert, which will help you send an email to your senators and to your representative. I'll do it again, but it's so important that they hear from you, whether they're Democrats or Republican. We've never had a Republican co-sponsor. Hopefully we will get one soon, but they need to hear from you. It's something that they need to pay attention to.
Mickey Leader has her light up. He or she has their hand up. Mickey Leader? Oh, how do we undo that?
Hey, Mickey, go ahead, and Bonnie, you're on deck.
Okay, I just wanted to say thank you for putting this on. There is so much for us to all fight for and advocate for, but some of the people in the PDA Zoom on Sundays have heard me say, I'm absolutely shocked at 78 years old, my best friend's granddaughter, 17-year-old athlete with no symptoms, was diagnosed in January with a rare form of Ewing sarcoma in her kidney and her lungs, stage 4. The kid is fighting for her life. The insurance refused to approve a $10,000 shot that Sloan Kettering doctors they're desperately trying to save her life, prescribed, and they wouldn't give it to her. The insurance didn't approve it. Unbelievable. This is why we need Medicare for all, why we need everybody gets covered, because unless we do, all of us are facing the insurance discovering they don't want to pay for something, and you die while you're waiting for it. And getting rid of cancer research for adults as well as kids, shame on those people who voted for it. Shame, shame, shame. Thank you.
And it's a little bit hypocritical to say that we're going to cure chronic diseases when we're cutting off all the research on it.
You're right. And it's the parent and grandparent and family's worst nightmare to face this. This kid is in so much agony and fighting so hard to live. And what can you do when you're facing bureaucracy? The numbers in your slides that show the tens of thousands of people, bean counters, as we used to call them, it's ridiculous. I have a chronic disease and they won't let me get my therapy. I've appealed it 3 different times. They could care less. So sad, too bad, drop dead at 78. It's just
Yes,
horrible, horrible.
Thank you,
thank you,
Mickey.
Mickey. Bonnie.
Hi, my name's Bonnie, and I'm from Seattle, Washington. I'm a retired nurse. I belong to North Seattle Progressives. We are very much in support of single payer, Medicare for all, universal health care. And I also participate in the policy committee for healthcare as a human right here in Washington State. Unfortunately, I missed the event that we had in downtown Seattle, so I'm really glad I just happened to get this and really glad to attend this. One thing, and I will continue to educate and advocate and participate in rallies, etc. But one thing I feel hopeful, but I also feel like things have taken a step backward for me personally, and was wanting to get your opinion. I know that this group is opposed to ACO REACH, and I just recently found out that one of the doctors groups here in Seattle, which is a pretty big one, and my doctor is in it, I got the notice about ACO REACH, and it just feels like, I'm sliding backwards. I plan to leave my doctor's practice and find another doctor, but that is not all that easy. And just wondering what you have to say about that, and how, where do I start in looking at different doctors' practices to find out if they are ACO REACH, because I have no idea who I would call, what department would tell me that. And maybe you could do a little education for people about what ACO REACH is.
I don't think I'm the best person to say. But it is one of those efforts to privatize medicine and limit your choice. My advice to my patients is, because I don't want anyone to go broke, that you start with a list from whatever your insurance is, whatever you're hooked up on. This is why we need to get rid of insurance companies, because you've got some kind of list of doctors to choose from, and no reason to go find, if get a referral to someone who's absolutely the best, and they're not on the list that your insurance gives you, you're really up a creek.
Mm-hmm. Absolutely. It's a mess. And we really feel for everybody who's caught up in this bureaucratic nightmare. I think it's designed to be difficult. And Mickey mentioned something about, too bad, so sad, get lost, drop dead. One of PDA's friends in Congress said that the Republican health plan was hope people die, and that's really what it is. It's sad, and like Representative Jayapal said, something like 70% of U.S. Residents support a Medicare for All plan. I think even more would if they realized how good it was, and if they're willing to pay more for it if people realize that we would pay less and give everybody all the health care that they need. The only people opposing it would be insurance company executives and maybe a few sadistic people. But that's what we're up against. And my heart bleeds for people who are dealing with this. I was without any health care for a while, and I turned out that I had a foot injury that would not heal. And I eventually went out of pocket to get it checked out, and wondering why it didn't heal. Turned out I had diabetes, and I don't know how many years I went undiagnosed and untreated. And that's the sad situation, that a lot of people have high blood pressure, or they have high cholesterol, or diabetes, or various other ailments, and these are things that can be treated. A lot of times it's expensive to treat some situations, but money should not be an object in this. It should be patients and their health care. And that's why we're here. Jeffrey?
Yeah, I'm presuming you can hear me.
Yeah, we can.
Just want to say thank you. And this effort needs to be kept on, really, for PDA, at least monthly, if not, more so, and keeping better track of the information to keep what going. I remember doing the 1600. I remember doing the 562 here in California and Sacramento. I spent the last 2 weeks dealing with the state on the issues of both the draconius, should we say, budget and the other aspects. So I haven't been to the Sunday PDAs for a while because I'm right now doing with another way of dealing with the diabetes undone. So in the process of learning so much information that my medical doctors never provided me with. So thank you. Keep up the good work. And, I will do the best way that I can be supportive. Thanks.
Well,
Thank
thank
you,
you.
Jeffrey. I
Yeah,
want to add, Mike, I want to add to what you said, your quote. Your quote was actually from Alan Grayson.
Grayson, yep.
He was the representative from Florida who got on the floor of the House and said, "This is the Republicans' plan. Don't get sick." Next page, if you get sick, die quickly. And that's really not changed. It was pretty dramatic, and I'm sad that it hasn't gone farther. And everyone has struggles. As a doctor, I will tell you, I didn't even work yesterday, but you know what? I spent 2 hours trying to get a medication for a poor teenager who's been suffering horrible migraines for a few months, and I can't get the medication. And doctors are not your enemy. I promise you, they are working overtime to fight these insurance companies with you. Paul.
Well, real quick, Jeffrey,
Oh.
thank you for reminding us that the PDA needs to stay focused on that. Your check is in the mail for calling attention to this. We are going to have a healthcare is a human right issue organizing team. Please sign up if you want to get involved in that team. We used to have that for years and years and years. It kind of went off the front burner, but we're bringing it back in a big way. And we would love to have you, all of you, sign up and join in. And the link is in the chat. We just had a steering committee meeting earlier today. We've got a great event coming up. I think, Mike Fox, can you remind me the date and time of the next meeting? And what does
The link is in the chat. It's Tuesday, June 10, 9 p.m. Eastern.
There you go. And somebody says, what does the team do? What we do is we organize around the issue. We mobilize support for this great legislation that Representative Jayapal co-sponsored in the House and that Bernie lead sponsored in the Senate. We reach out to people. We figure out ways of increasing outreach. We organize events like this one. We're going to do all we can to help the nurses who are facing excruciating patient ratios where hedge funds are buying up these facilities and cutting back on staffing and forcing nurses to cover more and more patients with less and less time off and not giving them the raises and the time off that they need. And now it's going into abuse of doctors as well, where doctors are being forced to do too much with too little. And what we need to do is care for our caregivers. And I was saying earlier this afternoon, the nurses really are the front line in healthcare. I love the doctors. The doctors are wonderful. The doctors are saving lives every day. That said, taking nothing away from the doctors, the nurses are the ones who actually provide a lot of the hands-on healthcare. The nurses are often overworked and underpaid, underappreciated. They risk their lives in many cases through the COVID pandemic. Nurses and doctors alike risk their lives to help treat patients. And they were not appreciated. And instead of being rewarded for it, they're being abused. We will not stand for it. So we're going to organize to rebuild our healthcare system from the mess it is, from the shambles that it's been. And then with the attacks on Medicare and Medicaid and in Trump's brutal budget on the way, the House passed it by one vote and the Senate is going to vote on it. We're going to do what we can to call attention to the harms and the millions of people who will lose access to healthcare. Entire regions will become healthcare deserts. We've got a lot of work to do. I think I'll stop listing what we need to do because that'll take up all day.
Yeah,
But,
Mike, let's move on. Paul
let's,
and then the whole Washington. We've got some videos I want to get to. We're,
that's right.
our first hour is almost up. Paul?
Yes, I just want to say real quickly a shout out to Whole Washington who's here. Also, I'm on the board of healthcare number 4us.org, which has a lot of information about single payer healthcare, a lot of educational information, and we have a radio show on KPFK every Friday morning at 7:30, which is very informative as well. But in the meantime, I wanted to mention that since Brian Thompson, who was the CEO of United Healthcare, was killed, the shareholders of United Healthcare, and I don't know how many people know this already, are suing United Healthcare because they're not hitting their bottom line. Can you believe it? And they want them to reject more claims. I mean, this is sociopath 101, you know?
All about the bottom dollar. Okay,
Yeah.
we need to move on. Oh,
Yes.
Washington.
Thank you. This is Catherine Lewandowski. I'm Vice Chair of Whole Washington, and I appreciate you putting this on. But I just have to be pretty blunt and say, I've been in this battle for like 8 or 10 years now. Many of you have been in the battle for decades longer. And I really think it is super important that we look at what has been done, all the work that has been done, and realize that has not worked. So what are we going to do differently? We cannot continue to do the same stuff that didn't work in the past. So I hope that you'll be open to looking at trying to chip away at this horrific healthcare system we have that is completely unsustainable. And at some point, I feel like we are going to be in the position where we are going to have to try to save what we can. I look at all of our rural hospitals that are going to have all of their Medicaid yanked out from under them, and these people still will need healthcare, and these facilities will be empty. And so maybe we do need to become like the NHS, where then we will have publicly owned hospitals, because the people in those areas still need care. And so I'm tired of calling and talking and getting ridiculous messages back from my elected officials. We all need to be like getting out there, picketing. So I appreciate what happened today, but maybe doing more, maybe doing some hunger strikes, maybe doing some 24-hour sitting on the porches. We really need to ramp this up, because yes, people do die every day, but they shouldn't have to be suffering with having all of their wealth and savings and equity in their homes and things that they want to pass on to their children taken from them, stolen from them before they die. Thank you.
Thank you.
Wonderful, wonderful sentiments. Love the passion. And as far as doing something different, well, we have more Senate co-sponsors than ever before. We've got a lot of House co-sponsors already. That's how legislation is done.
And I will say that Jayapal and Debbie Dingell and Bernie are really holding people's feet to the fire. I think something's happening, and I think it's different than it's been.
And
So
we're
I'm
also
hopeful.
getting close in New York State, Washington State, Oregon, and California all have single payer legislation that's moving through. In New York State, a majority of the House and the Senate have co-sponsored the legislation. It's just a matter of working out some details before New York State becomes the first state to have a single payer system. So we are doing things a little bit differently all the time. We are making progress all the time. And but I'm not going to minimize this. We've got trillion-dollar industries poised against us, and we need to overcome them. They're not going to go down without a fight. And let's see.
On with the show.
Okay, in terms of national single payer, that's not us. We are having an event to coincide with their organizing, and we love the organizing. We do support state plans. So let's all, not jump to any conclusions. We're going to get on with the show. Let's see, any more hands? Okay, great. Okay, so now we're going to see some hard-hitting, short blurbs that we can get out, and it's on YouTube, and we can share those around. They make the case in a very short short attention span way. So let me get that up and running. Excuse me, I'm doing a lot of things all at once. Share screen. Artist.
Like their insurance plans and want to keep them.
My insurance company won't okay the treatment that I desperately need.
Our deductible is so high, we can't afford to see a doctor when we need one.
Our co-payments went up, so we're putting off seeing our doctors.
I love my doctor. I hate my insurance company.
Medicare for All means freedom from insurance companies. Visit healthcareforall.org to make it happen. People can count on the healthcare they get through their jobs.
I lost my job because of COVID, and now we don't have health insurance.
My boss switched us to a high deductible policy, and now I can't afford to see the doctor.
If my union didn't have to keep fighting for our health care, we could negotiate a much-needed raise.
I hate my job, but I can't quit or I'll lose my health insurance.
Single-payer healthcare means you have great lifelong healthcare not tied to a job. Visit healthcareforall.org to make it happen.
If single-payer health care passes, should I be worried about my Medicare benefits?
If single-payer healthcare passes, seniors will no longer need to buy supplemental insurance. There'll be no more co-payments and deductibles. Benefits will be better, and the cost will be lower. It'll cover prescription drugs, eyeglasses, hearing aids, dental care, and dentures, and long-term care in your home. It also covers your children and grandchildren.
Single-payer health care will let me sleep at night.
Visit healthcareforall.org to help pass single-payer healthcare.
There you go. And I'll put the link into that playlist and we can all share that.
And can you play one of the cartoons?
I am not sure where that is, unfortunately. So I'll look for it. Yeah. That was what they sent me, and that's all that it had. It was the same ones in Spanish, no cartoons.
Mike, for some reason, my photo stays on the screen. And I've tried every way to close it down.
There should be like a little, let's see, like a little minus sign that you can click on. And that should take it off. And thanks everybody for bearing with us. We're doing what we can, a little bit short-staffed.
Well, why don't you go ahead with one of the other representative interviews?
Okay, right now what I'm going to do is share that link to the playlist on YouTube so people can share that, watch that on their own. And let's see, we've got Representative Raskin. We'll have him come up next. Let me get that all straightened out. If people want to raise their hand and make a comment. What we're hearing a lot in the chat is people are frustrated. It's not going fast enough. Things aren't where they should be. And God, we know that's true. All I can say is look at how long it took women to get the vote. And women are still not in the Constitution. We ratified the Equal Rights Amendment in enough states, but it's still not in the Constitution. It's frustrating. There are things against us. It's very aggravating, but that doesn't mean that we're going to give up. And here's the other thing too. And Mike Fox says he's a civil rights movement. We had people who were enslaved and they were considered property. And it took all of us centuries to get to where we needed to get, and we're still not there yet. There's still systematic racism. There's still, horrendous civil rights violations and voting rights violations. We got, I'm not going to lie to you. I'm not going to say it's going to be easy. That's why they call it a struggle. And that's why we're here. We're not here because it's easy. We're here because it has to be done. And while I'm looking for, okay, Rick LaMonica, please unmute and share us what you've got to say.
I just want to remind people that a lot of this boils down to who's paying the clowns that we elect in Washington, and they're not dumb, they're just bought out. And PNHP and a lot of other groups, when the Supreme Court ruled on Citizen United, formed Move to Amend, and we're trying to get campaign finance limits back in there and eliminate dark money. And if we do that, then maybe the elected officials would actually be more interested in voters in their districts than they are to who can give them big campaign checks.
Thanks so much, Rick. That's absolutely right. And PDA focuses on that as well. We've got to clean up our politics. Okay, I do have Jamie Raskin's video. I'm going to be sharing that with us in a couple of seconds. So stay tuned.
Hello, everybody. It's Congressman Jamie Raskin from Maryland's beautiful 8th Congressional District. Hello to all my friends and Progressive Democrats of America. Hello to Mike Hersh and all your fantastic organizers there. Thank you for what you are doing to defend us in this nightmare as we continue to fight the fight of our lives. Sometimes people say to me, well, look, is it more important to be defending democracy and voting rights and the right to participate, or is it more important to be defending Medicare and Social Security? And my answer is very clear. You can't do one without the other. We've got to defend democracy and all of the great programmatic and institutional achievements of democracy. And you can't defend Medicare and Social Security and Medicaid without defending democracy, and you can't defend democracy without defending the progress we've made under democracy with those programs. Now, you know that the Republican-controlled House just voted by the barest of margins, 215 to 214, on the same day that my late beloved colleague Jerry Conley from Virginia died. It would have been 215 to 215, but in any event, they voted 215 to 214 to basically rip Medicaid away from like 14 million people in the country, as well as ripping nutrition and the SNAP program from millions of people in the country. But also, there's an attack on Medicare that's in there too, because there's going to be such a drawdown on the resources of the federal government that it's going to trigger hundreds of millions of dollars, if not billions of dollars of cuts in Medicare. And of course, the enemies of Medicaid are also the enemies of Medicare, and they're the enemies of Social Security. They're the enemies of any programs of social solidarity that the American people have fought for throughout our history in order to create a society where there's a place for everybody and we can get health care to people. But constantly, there is this undertow of right-wing politics attempting to fight for huge billionaire tax breaks in the country. So I want to just thank you all for hanging tough for democracy and for Medicare, one of the great achievements of American democracy. And I look forward to working with you in the days ahead. Best of luck at your meeting.
Now, Jamie is right in the teeth of it, trying to rally the forces in the House to fight against this Trump-led attack on modernity, on medical care, on Social Security and nutrition, so many other things. And you can see in Jamie's face that this is a costly battle, but it's one that we can't afford to lose. And I'm so glad to have Jamie as my Congress member. And you know, he basically told us the truth that we're facing an incredible assault and we have to be strong. We have to be united, and we have to be empowered. And that's what this is about. If I could call on Mike Fox for just a couple minutes to tell us about how we're going to continue this fight tomorrow. We're going to have an important town hall meeting, and you're all welcome to join us and to invite your friends. Mike Fox, if you're available.
Yeah, sorry, Mike, I'm multitasking here, cutting phone lists. But in any event, thanks everybody for being here. Yes, every Sunday, 4 o'clock Eastern, 1 o'clock Pacific, we have our progressive town hall, excuse me, that originated 5 years ago as a response to COVID. And so healthcare is deep in the roots of that weekly call. I'll toss that link into the chat. It just so happens tomorrow we are featuring John Bonifaz, who is a constitutional scholar, focusing on what can be done about the lawlessness that we're experiencing right now. We'll also be discussing a single payer health care supporting candidate for Arizona's 7th district. Speaking of getting to work, there's a special election there as the late great Raul Grijalva unfortunately passed a few weeks back, and his daughter is standing up. He was a single payer health care just stalwart. She will be as well, and there's ways that everybody on this call can get involved in that campaign. Vote by mail ballots are dropping literally in just a couple of weeks in that special election. So a way that everybody here can have a positive effect on single payer is by making sure that she takes this special election. Likewise, I'll be dropping into the chat, it's been mentioned a couple of times. Sign up for our Healthcare is a Human Right Issue organizing team. I'll toss the link in, and that way you're up to speed on everything we got going. Healthcare for all oriented, be it single payer at the national level, be it the state level. We at PDA are all about just move the damn ball down the field. We show solidarity with anyone who is proposing, look, here's a plan for everybody in, nobody out. And that's the kind of energy that we bring to those calls. If that sounds like the kind of energy you want to be a part of, great. Sign up for that. And I'll likewise toss into the chat the link to register for our issue organizing team monthly meeting that is coming up on the 10th. That's Tuesday the 10th, 9 o'clock Eastern, 6 o'clock Pacific. Does that do it, Mike Hersh?
Sounds good. And if you could do that quick wrap about being with people who get it.
Sure. The key energy that you'll find on that Sunday town hall, and likewise, we do a weekly Thursday campaign to victory call. In both cases, this is about human beings coming together, showing solidarity with each other, and knowing that they're surrounded by people. I always use the phrase, people who get it. It's designed literally to, number one, get us closer to our goal, but a very close number two, it's about building community. What we're about to stand up against here have been standing up, and it's going to take a lot more standing. The kind of forces that are coming at this democracy, it's going to require an awful lot of solidarity amongst all of us, an awful lot of us supporting each other, literally providing health care. And I'm sure Dr. Nancy will give me solidarity on that one. Knowing that there's a community that is most importantly working to make sure that we get where we need to be by, number one, fighting back against what's coming at us, moving through it, and moving towards the light. And so we want every one of our Sunday town halls, as well as our Thursday campaign to victory calls. We hope that you leave that call literally feeling better. There is healthcare attached to it. So we welcome you. We advocate for you joining those calls and getting some health care in the process. All right, does that do it, Mike? We evidently have technological challenges.
Thank you so much, Mike Fox.
Yep,
And if you,
all good, brother.
you could drop that link in for tomorrow's town hall.
It is coming along with the link for the Healthcare Human Right Team and the link for the call on Tuesday the 10th.
And if anybody wants to pitch in, if you've gotten fired up by what's going on, please drop a few bucks into the tip jar. Any amount would be very welcome. We've got single payer healthcare for all, Medicare for all action fund. And we're going to use every dollar that you contribute to put on programs like this, to get people mobilized and to get more co-sponsors and organize more events. So hopefully that will inspire people to pitch in. And I will be ready to share a cartoon in just a couple of minutes. Hold on a second, please.
And thank you, Mike Hersh, for your yeoman's job on making sure the buttons are pushed. I'm glad I don't have that job.
Yeah, look, I'm trying to make it look easy. I don't know how I'm doing, but
You know, my picture's in there. You gotta
do that. Click on the minus sign.
There's no minus sign.
It's not going to happen. Next.
Oh,
everyone is born and someday everyone will die. Everyone gets hurt and sometimes everyone will cry. Everyone gets ill and needs some care to help us thrive. Healthcare that can help us to survive. In many other countries, they've got healthcare guaranteed. So they have to budget for their people's healthcare needs. Compare that to America, where healthcare is a mess. What does every other country pay? Just guess. Less. A whole lot less.
If you don't have health care, you don't have a prayer. In many other countries, they've got single payer. People are empowered and they've got a voice. And when they get sick, they go to a doctor of their choice. Yes, there are taxes that they have to pay, but it's still a lot cheaper than the USA, where we got costly medication in our pharmacies, co-payments and high out-of-network fees, and insurance companies' administration costs. If you get sick, you're headed for a world of loss. 62% of people's bankruptcy is from somebody getting sick in someone's family.
Now we pay more money, but we're living shorter still than many other countries with a lower healthcare bill. If we switch, our cost would be, it's not too hard to guess, with Medicare for all in the U.S. Less, a whole lot less. We could keep repeating all the very same mistakes. If we want a different outcome, we know change is what it takes. Let's build something better than the thing we had before. Let's be glad for what we have in store. We'll have more, a whole lot more.
Let me. These cartoons are produced by Cliff Tasner, who is our chairman of Americans Democratic Action. And he's done a great job with a number of things. And I think he would be okay me sharing the links.
Okay, thank you so much, everybody. That was a wonderful cartoon. Here's the link that you can share around. Let's see, Yvonne asked, can we get a copy of the cartoon? I just put a
I
link.
just put a link for all three of them.
Beautiful. Thank you so much. Okay, I'm not seeing that link though, Dr. Nancy.
Oh, there.
Beautiful. Okay.
The middleman is a really good one. Can we see
Okay.
that?
I think we can. So let's see if I can make this happen. Boom.
Healthcare guaranteed. Health insurance company, what do you say?
We're making mighty profits on the money you pay.
Health insurance company, what do you do?
We are the only thing that stands between your doctor and you. The health insurance money train is loading up at the station with employer contributions and the premiums you're owing. While we at the health insurance company wait in anticipation. When the train gets here, we get to decide where all that money's going. We take 30% of the money when it gets to us. A bit for advertisements and a chunk for administration and lobbying and something we don't publicly discuss. The millions of dollars we pay for executive compensation.
Health insurance company, what do you say?
We're making mighty profits on the money you pay.
Health insurance company, what do you do?
We are the only thing that stands between your doctor and you. When you get to see your doctor, she is waiting for that train. But it's claimed that we refuse, means more money we retain. Those tests that we allow, those procedures we okay, mean co-payments and deductibles that you have to pay. Oh!
Then the people bought a new train and they built a brand new track that goes straight to your doctor, so it's never coming back to the company in the middle that got a taste of each transaction, and the people pay less money for a lot more satisfaction.
We lobbied the politicians to persuade them not to do it. Our multi-million-dollar ad campaign, they saw right through it.
There's guaranteed healthcare for everyone, comprehensive and complete.
Now our health insurance company is obsolete.
Health insurance company, what do you say?
We made some mighty profits, but it's all gone away.
Health insurance company, why are you so blue?
Now there's nothing left that stands between your doctor and you.
Now, these cartoons are about the California initiative to have a single payer system in California, but it applies in all the different states and nationally. And Mimi Gurman says someone should cough up the funds for this one as a commercial on Fox News. Yeah, a lot of Fox News viewers would be very supportive of Medicare for all. When Bernie goes and talks to them, their Fox hosts get flustered because the handpicked audience of Trump voters listens to Bernie and they like what they hear. So that's a terrific idea.
I want to tell you that Cliff has done a number of commercials, wonderful commercials for California elections, and he is available to edit any of these to meet your needs. And I'm going to give you his email.
Yeah, a friend of mine who works in the New York legislature told me he's frustrated because a lot of activists like us aren't engaged in what's going on in New York. And I did mention, and I want to underscore this, they have enough co-sponsors in the House and the Senate. I guess they call it the Assembly in New York State, but they have enough co-sponsors to pass it. You just need to work it through some static from some unions that are worried that if everybody has the same healthcare in New York, then they'll have to figure out something else to provide for their rank and file members. But that's something that can be done. Somebody mentioned in one of the videos, if our union didn't have to haggle over health insurance, they could get us some raises. And that's what it really comes down to. We are wasting so much money on health insurance that it's soaking up potential raises for people and benefits. It's costing municipal governments and state governments incredible amounts of money. It's a major tax on all of U.S. businesses that makes it difficult for us to compete. And so this is something that absolutely needs to be done. The mystery to me is why more businesses aren't in favor of this. And if anybody wants to raise their hand and speak to that point, there's a really good video that was put together by a business person who realized that he was getting screwed because he was having to spend so much money on insurance for his employees. And even then, they weren't getting the care they needed. So if anybody can jog my memory of what that was called. Dr. Bill, you might know that.
Mike, can you go ahead and play the third cartoon?
Yeah, hold on just a second. I'll get that ready to go.
And we have one more interview.
Yes, we do. Yeah, please raise your hand if you want to say something while this is going on. We want this to be a very interactive town hall. Piece of legislation. That's the next one.
It's so interesting visiting the state capitol. I wonder who that fellow over there is.
I'm a piece of legislation here to get consideration. I'm at the State House Capitol awaiting my fate. If I should get passed, then it is gonna be great. And health care for all will be the law of the state. But this could take time. So I'll just have to wait.
Doesn't legislation have to do something?
Well, if I become a law, then every Californian will have health care without co-payments and deductibles. Oh boy! I just got passed by the Senate Appropriations Committee. They realized I can provide comprehensive health care for every Californian for a lot less money.
Who are all those people?
Those are insurance company lobbyists trying to convince legislators to vote me down.
Why would they do that?
Right now, your health insurance costs a lot to provide. With health insurance companies along for the ride, they decide if you can see the doctor you need. It's not health care for everyone. it's not guaranteed. Most people never know some of their premiums go to pay for lots of lobbyists and some CEO who's making so much money that it doesn't seem fair. Money that should all be used for medical care. So if I get passed, they will be feeling some pain the day they'll all be stepping off of this gravy train. Good morning, State Senator.
Who's making all those phone calls?
Those are California citizens calling their legislators and urging them not to listen to insurance company lobbyists who care more about profits than people's health. Oh my goodness, I just passed the state senate. I'm a piece of legislation here to get consideration. I'm at the State House Capitol waiting my fate. If I should get passed, then it is gonna be great. And health care for all will be the law of the state.
What happens now?
First stop, the Assembly Rules Committee. Here's where my sponsors can amend me and add all the details about how I'm going to be financed.
What happened?
The Speaker of the Assembly has put me on hold. I can't be amended. I can't move on to the other committees and then get a vote on the floor of the Assembly. I'm just stuck here.
Why would he do that?
Some of these state representatives get a lot of money from the insurance industry, so they're more concerned with the needs of their big donors than the needs of their constituents. If I pass, insurance companies will no longer be lining their pockets so they can deny Californians health care. They want to make sure I never see the light of day. I could die here.
Well, what can we do about it?
You can call your state representatives and attend their town halls and show up at their offices and let them know that you won't rest until California joins the rest of the civilized world in providing guaranteed health care to all its citizens. I'm a piece of legislation here to get consideration, and I'm stuck here in committee just awaiting my fate. If I should get passed, then it is gonna be great, and health care for all will be the law of the state. And now it's time for a choice. Will the Assembly come through? If you keep raising your voice, they just might listen to you.
Thank you, Mike. Oh, Glenn Risden wants to. There we go.
Hello.
Hello.
I have some statements to make here about one medical the PCP of Behemoth that was a couple of years ago. It was acquired by Amazon, and it had been for a time an ACO, but as of December 31st, 2023. It is the Bay Area. The Bay Area offices are no longer in the ACO reach. So I thought that was a kind of a little victory for us, and at least it's not been acquired by United Healthcare or private equity firm, But there's also a story about a patient here in December of 2024 who had diabetes, and he was coughing up blood, and he was short of breath, and his feet turned blue. And so he contacted somebody, was a nurse practitioner, PI, I don't know who the hell it was there at One Medical. And they says, go and get an inhaler. So the poor guy died in the ER, and now their survivors are suing One Medical. So that's a little bit about my experiences in reading about One Medical.
Thanks, Glenn. Great stuff. I mean, it's a horrible tragedy, but what we're trying to do is collect testimony of people like that. I think that a lot of us have seen the movie Sicko. Donna Smith wanted to be with us today, but she's facing some health challenges herself. She was in the movie Sicko. And when I was working with John Conyers on Medicare for All, I suggested that we reach out to Michael Moore and see if either he or somebody else could do a follow-up called Still Sicko, because we are still very sick. Um, I really hope that I know this is um, late afternoon, early evening, depending on which time zone you're in. I know that it's a Saturday, but I really hope people would emulate the people who've raised their hands and shared with us. If Ken Kennegos, if I could put you on the spot, Ken. Um, I know you were at a demonstration today in Tucson, Arizona. If you wanted to give us a quick report on that, that would be most welcome. Go ahead, Ken.
Sure. Yeah, we had an event today for the Day of Action and was very successful. A number of different organizations in the Tucson area participated. The Arizona Medicare for All Coalition, which is a PDA-sponsored organization, and Veterans for Peace, and nurse from NNU and PNHP, and we had about 300 people in front of the federal building today. It was quite a successful event. So we
Thank
also
you.
had the Raging Grannies singing songs about Medicare for all. And yeah, everybody was very energetic and enthusiastic. And like I said, about 300 people were there.
Thank you so much, Ken. And Ken is a nurse. He rolls up his sleeves and gets to work saving lives, his day job. And it's always wonderful to have you with us, Ken. I call him Ken Do Ken because we just,
Retired.
if there's a job that needs doing, Ken is willing to do it. Thank you
Thank
so
you,
much,
Ken.
Ken.
You know, before
And
Nina speaks, I want to say something about Glenn's example. You know, one way that everyone's saving money in healthcare is by hiring people who are less qualified and giving them a protocol or a checklist to follow. And that's, you know, to me, that's the category that your example falls in. And it saves money. You know, you not only can hire a nurse and make them oversee 12 patients instead of 2 on their shift, but the other thing you do is you hire the guy who sweeps the floor and teach him how to pick up bedpans and feed the patient or whatever, and make it just a protocol. And protocols to me is part of the major downturn of the medical system. And a great example was from Dr. Lippin, who I shared an office with forever. He was an older pediatrician, one of these incredibly wise, experienced people. And he said, when a mom complains, why do I have to bring my child in? I could tell you he had an ear infection and you could have just ordered the medication over the phone. The proper pediatrician response is, ma'am, you don't hire me. You don't come here for me to tell you your child has an ear infection. You bring your child here to say that they don't have meningitis. And I think that's, you know, the higher trained people in medicine are responsible for having more of a big picture, knowing the risks, and taking a better history, which you don't get the lower you reach down to give people more responsibility. It's a sore spot for me.
Dr. Nancy, you're absolutely right. There's somebody was writing in the chat about hedge funds. What are hedge funds? That's a bunch of very wealthy people who get together and try to make more money. And the way they do that is by cornering the market on different things. And if they buy up Toys R Us and then drive it into the ground, then that's a bad thing because, you know, it's harder to get toys, but you can live without toys. When they buy up nursing homes, when they buy up healthcare providers and hospitals, and then part of their business model is just what Dr. Nancy says, is push down responsibilities to less and less qualified people. So if they have RNs and LPNs doing things, well, they command some money. If they're unionized, they get a reasonably fair wage. So what they try to do is push down that burden on people who have, like, you know, one of these fly-by-night college diplomas that aren't worth the paper that they're printed on. You know, hell, they'll try to get candy stripers doing the job of an LPN if they could get away with it. And under Trump, they're going to get away with it if we don't fight hard to make sure that the nurses get the respect that they need, support union nurses and nurses in general, and come to our Zooms. We're going to be meeting on the 10th, and we're going to be organizing on how to fight back against these abuses. What I'm calling it a war on healthcare. Trump and his minions are fighting a war on healthcare from everywhere, from the Centers for Disease Control and NIH doing research and warning us about infectious diseases to gutting Medicare, Medicaid, and university programs and research, this, that, and the other. It's hard to even keep up with it all. We are going to win this war. We're going to get Medicare for all, and we're going to do it because all of us are here. All of us are committed. All of us are brilliant, and we are going to win. Nina, what do you got for us?
Oh my God, I have so much to say. Taking away so much with the CDC and Bobby Kennedy Jr. taking away healthcare, stripping it away from kids, not allowing seniors, you know, the COVID vaccines and all that for kids and seniors. This reminds me, I say Schoolhouse rocks terribly, healthcare. We should put this on national TV. I mean, this is amazing. I've been getting letters back, and you know, I've been sending to Rick Scott, who's like the ultimate unking of Medicare scam, and he sends me back letters that have nothing to do with that. And then Brian Mast, of course, get letters from him. Oh, if something comes up regarding that, I'll bring it up. And guess what? He voted with the other ones too. So that's a fight here in Florida. But it's just horrible, you know, what they're doing. I mean, luckily with my health insurance, I fight with them all the time. With my doctors are great. I praise all the nurses, and God help the nurses, nurse practitioners, the whole back office staff in every place I've been to, you know, little that I've been to, but, you know, they've been wonderful, and you gotta, you know, give them a shout out, you know, for the help they do, and they're understaffed, you know, and look what's gonna happen if we don't have Medicare, Medicaid, benefits, you know, for kids and everybody. It'll be hurting, you know. And look what happened. I was thinking about the town hall that Joni Ernst did and what she said. Oh my God! And these were public. And if they don't vote, you know, for it, you know, whether or not they're up for re-election, we can get the House back. Maybe we'll get some senators to us, and oh my God, there's too much to say. I'm just in total awesome. And I signed up for the organizing Medicare committee too, healthcare. I signed up to join that committee, Mike, so, but I'll see you all tomorrow too.
Thanks so much, Nina. And you mentioned Rick Scott. He is one of the colossal rat bastards of all time. He's a disgusting human being, and he really should be in prison because he fleeced the taxpayers, and he managed to skip away from that. And if he wants to come at me, I have the truth to defend me, and I'll be happy to see him in a courtroom when it comes to that. His corporation was a bunch of bandits, and now he's out there lecturing people about how Medicaid is supposed to only cover poor people, this, that, and the other. Well, who does he think Medicaid covers now? He either is stupid or dishonest or both. And we want to make it so he's on the same health plan as everybody else. He deserves Medicare for all, nothing better, nothing worse. And but he also deserves to be in prison. So Dr. Nancy, what have we got for the next phase? I've got the last video from our Congresswoman queued up, but we can get to that, whatever you want to do.
And I want to say, if anyone knows anyone who wants to invest Cliff Tasner is happier. He really wants to redesign those cartoons to be more generally applicable, and we could show them nationally. But he's been looking for someone who's ready to invest in that. So if you know anyone with the means to do that, he's open to it. Would love for that to happen and post it everywhere. Yeah, let's see the last one. The last interview is Laura Friedman. She was a California rep who is now in the Congress, the National Congress. And she graciously gave us a video. And she's quite a mover and shaker, too.
Hi, I'm Congressmember Laura Friedman. I want to thank the ADA, PDA, Physicians for a National Health Plan, and everyone organizing this day of action. Special thanks to the advocates, physicians, and organizers fighting for healthcare justice across the country. Right now, more than 13 million Americans, including almost 3.5 million Californians, are at risk of losing healthcare coverage because of federal rollbacks. If Republicans move their extreme proposal forward, families could go without care, hospitals will be at risk of closing, and safety nets could collapse. It could cut at least $22 billion from federal Medicaid funding. It could even shut down nonprofit providers like Planned Parenthood by cutting them off completely from Medicaid funding. In my district alone here in Los Angeles, more than 25,000 people are expected to lose Medicaid coverage, and more than 9,000 are expected to lose Affordable Care Act coverage. This means children unable to see a doctor, families denied life-saving care, and providers forced to shut their doors. And that's just going to cost us all in the long run. When people can't see the doctor, they get sick and can't work and can't care for their children. When people can't see the doctor, they get sicker and they end up in emergency rooms costing everybody more money and of course leading to worse healthcare outcomes. These are common sense investments in the health of our families, our neighbors, and our community. But they're pushing changes forward designed to cut Americans off from care. Medicare and Medicaid is how we fix this, making sure that we continue to fund the system. It's more efficient and less expensive. We're already spending enough, we're just spending it wrong. The longer we wait, the more lives are lost and dollars are wasted. Now, I'll keep fighting for affordable health care for all Americans. I believe in comprehensive health care reform with programs like single payer, but for now, we have to protect Medicaid and the Affordable Care Act. So again, I want to thank all of you for your work, the clinicians, the communities, and I want to thank all of you who are great advocates, and I will continue to fight alongside of you for the health of America. Thank you.
Yay.
It's very well said. And it's great to hear from members of Congress who really get it. They understand that the organizing is happening here in the grassroots. And Nina's asking, what state does she represent? She is from the Los Angeles area of California. And it was tough getting members from California to participate because, as Dr. Nancy said up at the top, the Democratic Party of California is having its convention this weekend. So this wasn't necessarily the best day to do this, but I think we did pretty well. I think we've had a pretty good event, and I hope everybody's considered this a good use of their time. And we'll sign up to continue working and organizing, because we're not going to get a whole heck of a lot done on a Zoom. But if we keep at it and keep organizing and keep mobilizing, we will get the change that we need.
You know, I just had a great idea. Dr. G, are you still on the call? I think so. Oh, she might have left. Oh, there she is. Can you unmute? Dr. G is our in our ADA, Americans Democratic Action Foundation, which is the educational wing of our group. And I just had this idea, if we can figure out what Cliff would want charge to redo those cartoons, maybe we could set up a fund through the foundation and it's all deductible donations. What do you think, Dr. G?
I think that would be a capital idea. It will just take connection and communication between Cliff and us. And of course, the presidents of both 501c3 and C4 to see if everything is okay with the concept. So I don't foresee any roadblocks in the future.
I think we're going to work on that. So thank you all for attending. Anyone else want to talk? Open forum here.
Open mic night.
Jeffrey. Jeffrey?
Oh, you didn't, can you hear me?
Yes. Yep.
Okay. Mike, I hope you can bring up to, if Mike Fox is on there. I'm just reading through about the no contempt that's in the new legislation, which Trump has got in there with the Republicans. I hope somebody notices it and reads through it. That's it right now. I'm reading through it right now as we're doing this.
Thanks, Jeffrey. Rick LaMonica.
What was the name of the woman that was the LA congressman? The name flashed on the screen, but it was too fast for me to catch it.
Oh, thank you for asking. That was Laura Friedman. She was recently elected. She replaced Schiff, Adam Schiff, who moved on to the Senate. And she represents one of the districts in LA. Carol, please unmute and tell us what's up.
Hi, everybody. I just want to say that I'm glad Laura Friedman mentioned the ACA, because the GOP wants to cut that also. They want to make the paperwork more difficult for not just people on Medicaid, but people who get their insurance through the ACA also. And the other thing is, if they let the tax subsidies expire this year for the ACA, people who have their insurance through the ACA could pay up to 75% more. So they're going after everything. And, you know, we've got to make phone calls. You know, hopefully there's some groups that are making phone calls to people in Republican districts or Republican states to get their senators to not support this bill as it is now. That's all I have.
Good stuff. I actually have an action alert that goes to the House and the Senate, and I'll try to get that up. Yeah, I think that hopefully this will go back to the House, because the legislation that the House passed by a single vote, as Representative Raskin explained, is so horrendous that I do believe that the Senate will make substantive changes and it will need to go back to the House for another vote. I might be naive about that, but yeah, we have got to stop this horrendous legislation. And I'm going to drop a link into the chat. This action alert mainly focuses on the cuts to Medicare and Medicaid, but there's also other horrendous cuts in this brutal budget bill. You know, Trump calls it his big, beautiful bill. I call it the brutal budget bill. It really is a war on the American people, and we're not going to stand for it.
Dr. G, can you please put the address for the ADA Foundation in the chat, and it's all tax deductible, and we'll take donations and get those cartoons done so they are generally applicable.
And here's a blog that I wrote about Trump's budget, and it includes a way for you to call both of your senators. And a lot of the people on these Zooms tend to be in blue states and blue districts. If you have anybody that you know who's in Alaska or Kentucky or Arkansas, Arkansas is going to lose most of their hospitals if this thing goes through. They're hanging on by a string, and with Medicare and Medicaid cuts, these hospitals will go broke. And so at least one of the Arkansas senators is expressing concerns about it. But if you click on that second link that I put in there, Stop Trump's Budget, it'll take you to an article I wrote outlining some of the horrors in this, and share it with people that you know in red states. Every time we send out an action alert, somebody belly aches and whines and cries, "Yeah, they're never going to listen to me." Well, they're never going to listen to you if you complain to me and don't call them. If you call them and give them a hard time, maybe it'll make a difference. I can't guarantee that it will, but I can guarantee that if you complain to me about it, they're not going to hear about it. And they're very happy to have you complain to me and complain to PDA and complain to Dr. Nancy rather than complaining to your elected officials. Don't be a wimp. Don't let them cow you. Don't let them train you to be an obedient little lapdog and roll over and play dead when they pull this crap. They count on you being a wimp. I don't think anybody on this Zoom is a wimp. I think you're all courageous. I think we're all watchdogs. I think we're all guard dogs. And I think we're all going to fight for what we believe in. And if the Republicans or a corporate Democrat tries to brush you off, we are not going to let them brush us off. We're voters in this country. We're residents in this country. Whether, whatever we look like, wherever we came from, we have a voice, and we are not going to go down without a fight. We are not. And I think you're all with me. Let's hear for we're going to hear from some people who haven't spoken yet. Lee, if you would unmute and share your wisdom with us, please.
Hi, yes, I'm in Tucson. I just want to remind people that when we talk about saving the ACA and saving Medicaid, that we don't stop with that, because a lot of people in this country do not understand that those are not as good as Medicare for all. And a lot of people do not understand that, and we need to make sure that anytime we talk about saving the ACA and Medicaid, which Medicaid is almost entirely privatized now, that we make sure people understand that saving them is a stopgap measure. It is not the end. It's not the end all be all.
Thanks so much, Lee. We've got a long way to go, and thanks for reminding us.
And we have Anna Malinow in line.
Anna.
It was her idea this whole day.
Hi, well, it wasn't just my idea, but yes, my name is Anna Malinow. I'm a retired pediatrician in San Francisco, and I am on the steering committee of National Single Payer. And as you all know, the National Day of Action was an idea that was started by National Single Payer by an op-ed that we wrote back in January, where we called for a National Day of Action. And since then, over 140 organizations, local and national organizations, have endorsed the National Day of Action. And we had actions in over 25 cities. There are many that we didn't even know about, 25 cities across the country that came together to demand that we put single payer on the nation's agenda. I just want to maybe reiterate what Lee was saying, and that is that, when it is a natural reaction when we are under attack to go on the defensive. However, and we are under attack. I mean, there's no denying that. But we know that the best defense is good offense. And that's what the National Day of Action was all about, is to go on the offensive, is to demand that we put single payer on the nation's agenda, that we demand that we remove profit from healthcare. So that's what the National Day of Action is all about. And while, yes, we are under attack and we have to, protect the programs because that's our natural reaction, the truth is that the best way to save Medicaid is to have a national single payer program. The best way to eliminate those work requirements and the insane paperwork that people have to fill out in order to prove that they're worthy of Medicaid is to have a national health program. And the best way to eliminate Medicare Advantage overpayments is to have a national health program. And the best way to negotiate at the bargaining table for higher wages is to have a national health program. And so I think that I hope that what this National Day of Action has taught people, and I'm just so thrilled to hear that 300 people were at the action in Tucson. That's just fantastic, is that we need to go on the offensive. We are tired of being on the defensive, of always, like trying to protect the crumbs that we have. We need a national single payer healthcare system free from profit. So, and the ACA, yes, it did decrease the number of uninsured, but it just increased significantly the number of underinsured and the number of medical bankruptcies. So we cannot say, oh, what we have to do is to save the ACA. Absolutely not. People are sick and tired of the status quo. And that is what, the reaction, the righteous anger that was a result of the shooting of the United Healthcare CEO showed, is that people are sick and tired of their insurance companies. What they want, they don't want the status quo. They want a national single payer healthcare system free from profit. Thank you. And thank you, Nancy and Mike, for putting this together.
Thanks so much, Anna. Thank you for the op-ed. And you never know where an op-ed or a conversation is going to lead. And
exactly.
where that op-ed is going to lead is a Medicare for all single payer system here in the United States. And I'm going to drop in again. If you click on that link, it'll let you send an email to your representative and both of your senators. And I don't care if they're Republicans. I don't care if they're the worst people in the world. I don't care if it's Rick Scott or any of these other lunkheads. Send it to them. Let them know that you demand a single payer healthcare system for everybody. They're not going to go along with it, but make them put a little heartburn in their life, that what they're doing, that you're seeing them, and you demand that they do what you want them to do. They're not going to do it, but we'll replace them by and by. But make them miserable until they give us what they want. I don't care if it's a Democrat or a Republican. If they're not co-sponsors, they need to hear from you, and they need to hear from you all the time until they do the right thing. It's like my friend and mentor, the late Tim Carpenter, used to say, if they won't see the light, make them feel the heat. And let's see, Anna, I think, okay, if you want to raise your hand again to say something else we've heard. Okay, Paul Washington, you've got some words of wisdom for us.
Thank you. I just wanted to say that although I do appreciate all of the additional guarantees within the ACA that were desperately needed at the time, developing a healthcare system with all these subsidies for the insurance companies and not lifting up our children's abilities to be able to afford even just to live and to pay for the healthcare that they might need. We can't continue to do that. That is, in my opinion, that's what's put us in the position where we are now, where we're at risk of losing all of those subsidies and the whole system being yanked out from under them and people losing everything. So we can't.
If I can just ask you there, 100% agreement on all of that. Thank you for the passion. Thank you for the insight. What do you think we should do now?
I think that we need to work at local level to get to save as many people as we can. Like I said, if our hospitals that I have visited in my rural areas of the state, if they are going out of business, all those people are still going to need health care. So I think we need to be looking at making those public hospitals, financing them with global hospital budgeting, and because they still are there's gonna be a need, but we're at the point where we really have to save as many people as we can.
Okay, then you.
Thank you so much for that. And I really love the component. We're going to have to figure out ways of keeping these hospitals open in rural areas and in underserved urban areas, especially. And your words of wisdom strike, right at the heart of the matter. Thank you so much for that. Thank you. And I hope you'll join our healthcare as a human right issue team and bring that wisdom and that determination to work locally, because that's something that we sometimes forget, and we need to stay very mindful of that. Nina Singer.
Okay, just to add again, oh my God, I have so much to say. I tell you, I'm gonna never back down on Rick Scott and Brian Mass. I'll keep sending them letters. They'll keep sending me back letters until they do something. We have a big VA hospital right here in my county. They're going against Brian Mass. He's a veteran too, and he's not too supportive. He says he is, but he's not. And number two, what was I gonna say? Oh yeah, this is important though. The Medicaid with all that stuff. I'm never gonna back down, never. And that's, until, oh yes, if there's anybody here on this call that knows anybody in Missouri, believe it or not, I hate to admit it, Josh Hawley is going against, what they're doing in that bill. The citizens, if he agrees with the Democrats or not, let's wait and see. But if anybody, I'll call him myself if somebody gives me his number.
Well, if you go to that, the link that I put in about stopping Trump's budget, it'll takes you to where you can get every senator's number and call them and give them hell.
The Democrats, yes, I know about the corruption with the healthcare. Senator Whitehouse in Rhode Island is big on the dirty money that's been going out, especially through the Supreme Court on that too. But but I'm in Rhode Island. I have what I have to face here in Florida. I wish we have a single payer healthcare in Florida, because what's going to happen with the kids on Medicaid, it's horrible. Horrible.
Yeah. Well,
Mike, it is after 5 o'clock.
Yeah, we are officially in overtime. We need to wrap this up. I don't see anybody's hands, so that's good.
I'm going to get the address and blast everyone for donations to get those cartoons redone to be nationally available.
And I also signed up to be on that organizing healthcare committee too, Mike.
And if you want to join her, join Nina and all the other wonderful people who've signed up. I just dropped that in the chat again. Sign up for the healthcare as a human right issue organizing team. We got to keep the momentum going, where this is just a start. We have to build on this. And I love the fact that we still have 52 people here, 51, even after we told people that they could go. We will wrap up the next few moments. Let's see if I can drop in a few other links really quickly. Okay. PDA is organizing for Medicare for All. We have been since our founding. We've worked really closely with John Conyers and then Pramila Jayapal. We work with Ro Khanna on his state-by-state Medicare for All single payer plan. And I think Senator Markey has the Senate bill for that. We've got a lot of things that we're working on. Let's see, One Payer States is having a hybrid event in Denver. That's wonderful. One Payer States is a great organization. One of my best friends is Chuck Pinocchio. He's working on that as well. And we're going to get it done, one way or the other, or both.
And I want to urge people, not to spend energy on the individual different approaches to single payer. We all want the same thing. And I really want that energy going to the legislators to get this done, however it goes.
Absolutely. And I try not to be cynical or skeptical, but when I see people dividing the movement and bad mouthing each other, I wonder, are they paid for by the insurance companies? Because there are agents provocateurs. Or are they just the kind of people who can't get out of their own way? And it's, back in the 60s, they used to say lead, follow, or get out of the way. If you're making heartburn on our side, rethink what you're doing, because that's not the way to do it. PDA is going to be having a follow-up event to this on June 6th. Thank you, Mike Fox, for sharing that. PDA is also going to be having a Zoom tomorrow. We have Zooms every Sunday and Thursday. And for the Zoomaholics among us, we will keep you occupied. We will keep you working and rocking and rolling. So Mike Fox, if you could drop the link for the Zoom tomorrow. There we go. Every Sunday, tomorrow, 4 p.m. Eastern, 1 p.m. Pacific. They're always wonderful, always worth your time. Wonderful guests, great ways to get organized. We're not going to stop. We're not even going to slow down. And the Campaign to Victory call every Thursday. That's it in the evening for people who have to work or do something else during the day. That's a great call to get involved, roll up your sleeves and get work done. That's what this is about. We had a great informative session. I learned a lot from you, Dr. Nancy, as I always do. You're absolutely wonderful. Your slides are great. Those cartoons were next level. Those brief ads were terrific. And the messages from the representatives were so exciting and inspirational to me. They couldn't be with us in person, but they went out of their way to be with us through video. And I deeply, deeply appreciate all three of them for pitching in and helping. And thank you so much to everybody who spent your afternoon and evening with us on this Zoom. I'd like to go and grab some dinner if I can. So thanks, everybody. To be continued. Thank you, Dr. Nancy. Any closing words?
No, thank you for pulling this all together. And I'm real proud of what this happened. And I think we are inspired, depending on where things are. Maybe we'll do this again in 6 months or so, maybe sooner.
Absolutely. We're talking about doing something around the anniversary of Medicare. Medicare is getting closer to be of the age to qualify for Medicare, but Medicare is still too young to be on Medicare. That's one of the things that we'd like to change by getting Medicare for all. So thank you so much, everybody. You lift me up. You make me feel better about the challenges that we're facing, and we shall overcome. So I'm gonna allow everybody to unmute and
save the chat.
Yep, if you want to. Let's see. Settings. Okay. Now everybody can unmute and give us a war whoop or some inspirational saying or something.
Good night. Stay safe.
Stay
That's
safe
our
and
hearts and
well.
all our other parts.
Thank you.
Good night, everybody. Medicare for all. We'll get there.
Namaste.
Thanks all.
Thank you.
Grateful for all your hard work.
Thanks, everybody. Take care. And we'll see some of you tomorrow. And we'll see you all in the grassroots.